Hi, Mrs. Lyons.
Hello.
My name is Daisy. I'm one of the nurses in the clinic today.
Okay.
And I understand from Dr. Patel that you have a few questions of why you're here today.
Yes.
So what can I help you with today? What can I help answer for you today?
Well, I have this small scrape on my leg. It started out as very small, but it started swelling, and the next thing I know, it grew out of proportion, and it's very painful.
Okay.
That's why I'm here.
Okay. So what do you understand about your condition with this? Why do you think this is happening to you?
Well, I have no idea. Like, it's just started, like I said, it starts small, then it grows big and painful as well.
Okay. So I know that you have come into the clinic quite a few times for this problem.
Yes.
So I just want to kind of review with you what this is, okay? And give you a little bit of an idea of what to look for in the future, okay? And what we use to do to treat this, okay? And in the interim, if you have any questions, just please ask me while we're speaking, okay?
Okay.
So what this happens is with this, what you're describing to me is there's a tear in the skin, okay? So with that tear in the skin, you do find that there's redness and then it blows up. And we refer to this as something called cellulitis, okay? I know it's a very big term, okay? But it basically means that there's a cut in the skin, and that cut in the skin has become an infection now, okay?
Yes.
And it's very, very important that we treat this. So as you know, that when you have come into the clinic a few times, the doctors have put an IV into your vein, into your arm, right?
Yes.
And with that, you understand that we are giving you antibiotics to treat that infection, right?
Yes.
So the reason that we have to treat it is we worry that it might get bigger, okay? And we worry about that infection going into your whole body, okay? And that is referred to something as called sepsis, okay? So that means that infection has become really, really big now, and that now it's gone systemically throughout your whole body, okay? So it's very, very important that you understand that, and you are already noticing it, that something has changed in your skin, right?
Yes.
So some of the signs and symptoms to watch for that you know that this thing is getting worse, okay? I know that you've come into the clinic right away when you know that it is already not looking good or something has changed.
Yes.
But when you notice, if you're ever at home and, for example, you've missed that part, and you notice that you've got chills and fever as well, you understand what chills and fever, having a really high temperature, okay? And you know that you have that shivering effect,
Yes.
okay? When you ever notice that, you're feeling more tired than usual, okay? It is very important that you come to the health center right away, okay? Because that can be very dangerous if you just left it like that, okay? I don't want you waiting for the nurse the next day to come to the house. We want you to seek medical attention right away. Okay, do you understand that?
Yes.
Okay. Now, what do you understand about your other health chronic conditions that you have?
I know that I have high sugar, and I have circulation problems.
Okay.
And I also have my blood pressure is high.
Okay. So all of those conditions that you have can be a factor into you having the cellulitis as well, okay? So it's very, very important that you are maintaining your sugars, that you are keeping good control of your sugars at home, okay? As well as making sure that your blood pressure is okay. And I know that the nurse comes in and checks all those things, okay? But when she's not there, it's very important that you are taking your medications on time every day, okay? Twice a day. The other thing to make sure is that the area that the infection is at, where you notice that that redness is at, that line that you see, you make sure that it is very clean all the time too, okay? Because we worry about it becoming even more infected if it becomes dirty at any time, okay? And I understand that you have a pug dog.
Yes, Tommy.
Tommy, okay, that's your favorite pug dog, right?
Yes.
So very important as well that Tommy is also make sure that he's also clean, okay, and making sure that his paws are very short, because if he cuts you, that also is a big concern, okay? Then that can also increase the cellulitis, okay? Our biggest thing is that we want you to heal. We want that area to heal properly, okay, so that the skin looks healthy, it looks pink, okay, and that you have no concerns with that, okay? But very important that you understand when to seek medical help, okay?
Okay.
Do you understand what I was saying? Do you want to kind of explain back to me what I'm referring to?
Well, I think from what I understood,
Mm-hmm.
you said that this thing that starts as a small scrape can
Okay.
end up having an infection in my whole body if I don't take care of it.
Exactly.
And also to keep my dog clean,
Right.
because that might contribute to my infection.
That's correct. Yes.
And so to take my medication on time
Mm-hmm.
and to take care of my sugar, because
Exactly.
that also can contribute to the infection. You
Exactly.
said?
Exactly. So yes, the most important things that I just said to you is making sure that area is always clean and healthy.
Okay.
Okay. And again, you know when to come to the health center when
Yes,
you need
and you
help.
also mentioned that I have to come to the hospital if I see any redness, if it's swelling, or
Exactly.
if it's painful.
Exactly. And so, and the other things, I know that you have the other health conditions as well, so I know that you have a problem with circulation.
Yes.
So very important that at nighttime that you are using your TED stockings on time, so you are getting good circulation, that the blood is flowing back into your legs properly. Okay?
Okay.
And I am going to give you a call in a few days
Okay.
to make sure that you're doing okay. But please understand that the medication that you had by the IV, okay,
Yes.
the doctor's going to give it to you for another 3 more days, and you're going to have it by mouth.
Okay.
Okay, so please make sure that you take those on time every day. Okay, it's going to be twice a day. So you want to take it in the morning. You can do it at 9 o'clock in the morning. You can do it at 9 o'clock at night.
Okay.
Okay, so you want to make sure that you keep continuing those for at least 3 more days, and then I will give you a call to make sure that you're doing well.
Okay.
Okay. In the meantime, if you have any questions or concerns, I'm going to leave you my phone number,
Okay.
so that way you can phone me. And I know that the healthcare nurse will be coming in to see you anyway, the home care nurse. So if there's a question or concern, you can always voice it to her, so that way she can give me a call,
Okay.
or you can give me a call as well too.
Okay.
Okay?
Okay.
Okay.
Thank
Any
you.
any other questions I can answer for you?
I think that's all for today.
That's all for today.
Yes.
Okay. All right. It was a pleasure meeting you.
Pleasure
Okay, and
meeting
I
you
hope you
too.
do well.
Yes, thank you.
Okay, you're very welcome.